The measles virus was declared eliminated in the U.S. in the year 2000. But the virus is back due to fears of the vaccine's safety and because of anti-vaxxers. Our expert explains.
People they're trying to do the best thing they can for their child. And we fall into traps. People fall into traps, and they're in a way victimized. Let's start with even the very first vaccine. First validated vaccine was by Jenner, and he gave cowpox to a little child and protected him from smallpox. And even then, there was opposition to this concept. Especially back then when we didn't even understand how these things work. Now we do understand. And during the 20th century, we had a lot of gains in vaccines. People were observing how we were actually reducing tremendous diseases that they had been acutely aware of by vaccination. And so our vaccination rates were terrific, and we were doing splendidly in the Americas, particularly in the United States. Right. But then in 1998, Dr. Wakefield published a false report where he lied about 12 patients, and he did it in a very reputable journal. And it took a long time to get back and look through the actual records of these patients.
And undo that damage.
Recognize that what he had said was false.
That vaccines cause autism.
That was one of the false claims that he had in his paper, which caught fire. And that, interestingly, that paper came out in '98. It took a while for the general public to become aware even of that paper. So it wasn't until the early 2000s that families became concerned about this horror, because there are rising rates of autism, and people are worried about that because that is a serious condition. And unfortunately, in our minds, we make a lot of false connections, people take out umbrellas at certain times and they link them to things that have nothing to do with why somebody might or might not have an umbrella. They might have it because the sun's shining, not necessarily because it's raining. I mean, there's all these false connections that we tend to make. And because we're grappling for reasons, and here's this man in a reputable journal making a claim.
It gave someone a concrete reason.
For why does my poor child have this problem. And it took literally hundreds of very careful studies by, the Center for Disease Control, the IOM, which is the Institute of Medicine, the World Health Organization, institutes in Europe, et cetera, to get down and redo and hundreds and hundreds of cases to try and tease out what was true and what was false. And it turned out that his work was totally false, that there's absolutely no connection, but it left this lingering doubt.
Some of which we're still dealing with, and with parents who choose not to vaccinate for that reason.
That's right, and that's a big shame, and very unfortunately, there have been big celebrity individuals who have poured money into these false claims and even upheld this person who, by the way, rightfully lost his
license. Absolutely. But it's the as you mentioned, that celebrity factor sometimes can do a little damage, especially when the facts aren't there.
And let's be frank, I mean, a lot of the new medicine, and especially with something as invisible to the naked eye as a virus, people don't understand. And so they have to be more curious, and they have to get in there and try and dig deep.
And do the research. Now, before we get into our myths, very quickly, what is herd immunity?
Oh, herd immunity, it's a concept from the veterinary world, right? Okay. Because it was recognized at the turn of from the 1800s to the 1900s that if you protected a certain percentage of the herd from an infection, you basically protected the entire herd.
Okay.
And that concept applies to protection from any infection in any population of God's creatures, including us. Including us. So, and for different types of diseases, you need different percentages of the population to be protected. For measles, you pretty much need about 95 to 98% of the population to have immunity so that this incredibly contagious virus cannot spread.
Okay, so let's quickly clear the air with some of these common myths. The first one is vaccines cause the illness they are trying to prevent.
That's a fascinating one. And that, remember when we spoke about the fact that many of the symptoms that we get from any disease have nothing directly to do with the germ,
yes,
but instead it has to do with how our body reacts. And since in many of the vaccines we have to show the body some aspects of that particular germ, the body's immune system reacts similarly to that actual wild germ being there. And so you see some of the symptoms some of the times. But our vaccines are wow, we are just getting better and better at making vaccines. We have so much new technology that we can target these vaccines now so that they produce even better quality immunity and are safer than ever and have less likely to produce any symptoms.
Which brings me to my next myth, which is the side effects of vaccines aren't worth the risk.
Again, first of all, the risk of the disease is always
larger,
much worse, exactly, and it can have devastating complications, including death. Right.
Now we have one more myth I want to get to before we go. They aren't tested enough, so the ingredients are harmful.
Oh, these things are tested up the wazoo. You know, it literally costs billions of dollars to bring a new vaccine to the market, you know, in terms of testing, at many, many different stages, many different levels of clinical trials, big human clinical trials before it ever becomes a licensed and approved vaccine.
Let's find out more on how vaccines work with our immune system to fight off those infections.
This is baby Jack. Vaccines help Jack fight infections by introducing a small number of antigens into his body. Antigens are parts of germs that cause Jack's immune system to go to work. After Jack gets a vaccine, his immune system will remember the vaccine antigen and attack that germ if it ever invades his body again. The antigens in vaccines are weakened or dead, so they do not cause illness. Vaccines contain only a tiny fraction of the antigens that Jack encounters in his environment every day. It'll take a few weeks for the vaccines to start working, and Jack may need more doses later to best protect him. That's why Jack's parents are following the recommended immunization schedule, because it is designed to give him the best protection possible from 14 serious diseases. Learn more about childhood immunizations. Visit cdc.gov/vaccines/parents or talk with your child's doctor.
And remember, if you have a question, reach out. We love hearing from our viewers. You can send us an email by visiting our website, allhealthtv.com, or give us a ring, 855-796-4475.